Okay.
And indoor.
This patient's name is Gus. He's not breathing well and his heart rate is high.
You take a big breath in for me.
Megan Stevens is a postgraduate student nurse who has worked at a family general practice clinic. She's learning techniques to react to different situations when Gus needs emergency care.
You know, the assessments are quickly of trying to figure out quickly what's going on with the patient and then trying to fix and giving him either some medication, cardioverting him, like we did today, and seeing if those if that works, and if it does not, like keep going until you can try to make him better.
I just can't seem to catch my breath.
The team interacts with the patient, whose voice comes from Stephen Hurst, the university's Director of Medical Technologies.
I tried sitting up, lying down, nothing makes it better.
Hurst also manages the computer and monitoring systems in the control room.
So the simulators we possess are high-fidelity simulators. They allow us to have our students interact with a physical mannequin and get the associated response, whether it's having, feeling pulses or hearing lung sounds or breath sounds.
This simulator is one of a family of 3 mannequin patients at Georgetown University, a man, a woman and a child. Hurst changes the symptoms as students work on the mannequin patients. He says the simulator is the most advanced teaching aid in medical history.
Every time it takes a breath in, the computer samples a little bit of that gas and figures out how much oxygen's in it, how much anesthetic gas is in it, and then calculates with the mathematical models for the appropriate response.
Program Director Dr. Karen Keston sets up particular scenarios before the class begins. Watching from another room, she can assess the nurse's ability to respond to unpredictable situations.
The simulated experience gives me the opportunity to evaluate my students' assessment skills and their intervention skills, their recognition of a problem with the patient, and how quickly they respond and intervene appropriately or inappropriately.
Student nurse Alexis Walter says the simulator enables her to experience situations she might never have come across before.
We get nervous because we have our instructors are watching us, and it is a place for us to make mistakes, but when you're in school you feel the need to not make mistakes, but it is honestly the best place to do it.
After the patient is stabilized, the students are given feedback on their performance, enabling them to take those lessons back to the clinics and hospitals where they work. Daniel Ryntjes, VOA News, Washington.
We're going to cardiovert.